Well,
You've got a
thank you
great
so
group.
much. Yes, lovely to have thanks for the opportunity. It's so lovely to meet all of you. First of all, let me start by saying thank you. Um, Often the people who do the large and difficult decades-long work to solve problems to help people don't often get thanks. So let's start there. I'm Joy Hermsen. I'm with Futuro Health. I will tell you a little bit about us, and you may know something about us. Not everybody. I always feel like I've heard of them. What are they doing? They started, but what happened? Like that VH1 channel. What happened? Where are they now? So I'm going to tell you a little bit about what we're doing, but we have some cool things that I'm hoping you might be able to connect us to people who might want some access to training. But let me just tell you quickly about my background. So I'm the Director of Innovative Partnerships. I have the wonderful job of being our external partner along with our CEO, Vontan Quinlivan, who many of you may know. My background is actually decades in retail, hospitality, and tourism, and human resources and adult education. One of my first jobs out of business school was running a national chain's corporate university. We got to build it from scratch and helping someone get from being able to run one restaurant to two allows them to be able to run 20. So if you think about the scale that would take, so I was recruited last year to join because in my last role, I was the statewide director for retail, hospitality, and tourism in the California community college system. Many of you may know that. I've also been a longtime instructor in community college and at what is now Cal Poly Humboldt. So meeting adult learners where they need is really a passion of mine. But I'll say that one of the best things about doing this is the problem's so massive that a unicorn Pegasus of a nonprofit, Futuro Health, had to be created, where the union and an employer decided, let's figure out how to train 10,000 people. So let's go. I don't need to, not yet to the slides, but basically in 2020, Futuro Health was launched as a partnership from SEIU UHW and Kaiser Permanente, with a goal in 4 years to train 10,000 people in allied healthcare jobs. So we launched, doors open January 2020, doors closed March 2020. And here we are, it's April 2022, right? And I'm happy to report we've trained over 5,000 people. And essentially the idea is, so here I have to do a little game with you first before we go into the slides. How many of you ever worked in some kind of retail, hospitality, or tourism job when you were younger? Like anybody? A couple hands? You know, waited tables or helped at a hotel or something. So when I worked in that space, and I should say that one of the things I launched in that space when I worked there in workforce development was helping people move from hospitality to healthcare. Because if you have those skills, you often can move quickly and easily without a lot of degrees or credentials, but people don't think about healthcare as a space to work in. The reason I ask that is because in hospitality, a lot of times people say, well, that's a throwaway job. Why are you there? So I'm glad to see that the handful of people that raised your hands admitted that you worked in some kind of retail, hospitality, and tourism job. Look at you. You didn't end up in a dead end job forever, right? That's such a farce, right? So I think what's interesting about what we're doing is Futuro Health's mission is to bring new people into the funnel of workforce, and then to help support them to continue on. What we're really building is career activists. So they don't just get a job, they have a sense of who they are, how they can help their family, how then that can help the neighborhood, how that can actually change. Social economic change isn't a large thing. It starts with one person. And so one of the things, doing what they need to do, right? That's kind of our approach. So I'll walk you through some slides, some career pathways. I'll tell you a little bit about the ways that we try to look at the entire ecosystem to figure out new ways to do things. So yes, people use certain things. So now you know the facts, right? Unicorn Pegasus, remember that. New to the sector. And then we're disruptive. So we don't just rely on one way to serve, and we have the student, the participant at the center. So again, I'm a longtime educator, and people will say, the universe has timelines, and colleges and universities have departments, right? So if it doesn't fit into the department, or if it doesn't fit into January and August start, forget it. You can't get the thing. So how is the person going to get the thing how are they going to get training if they can't get the thing? So, okay, I think I'm ready to do the slides, Lindy, but I think I wanted to start with, I'm just going to walk you through what we've learned, what we're continuing to learn. We are on track. We're going to train over 3,200 people. And I'll tell you what the different entry points are. Oh, before I go to the slides, though, to talk about it, can I just tell you that we actually do have several of you. Please reach out to me. We have a pilot going right now with it's with our first community college that's going to be able to offer medical assisting online. We will fully scholarship that. These are credit-bearing certificate units. They will get computer literacy. They will get Word and Excel. It's 12 months because it's designed to work with adults who are learning and working at the same time. And we will also, Futuro Health will pay for the first attempt and hopefully a successful attempt at the certification for a medical assistant, the certification for an MA. So we have these going right now. We have these scholarships available and they're available to the public now. So anyone who wants to apply should go to futurohealth.org. I can send you that. But for this pilot that we're doing, we have a window till the end of April where if there are organizations who want to support by saying they want to be a clinical externship partner with us, or that they have people they want to train and they want to work with us to get the clinical externship. I've worked with 3 nonprofits and 1 workforce board that's actually paying the registration fee. So there's a $100 registration fee, and then the rest of the tuition, all the books and supplies, and all of the certification test exam costs, we pay. So there's this like 150, and then there's like this other chunk we pay. So if you're interested, email me because we have seats available. That class starts June 6th, and then it's about a year, and then they start their clinical externship in April, and they're done by June of next year, roughly. Anyway, so sorry, that was my big pitch. I will go to the next slide, please, Lindy. So now that you know who we are, so let me tell you a little bit about.
Sorry, 1 second.
Or no slide. Now that I can see you eye to eye, I'm not like, what's the catch? There is no catch. We want to train people. We're going to train 2,000 medical assistants. Bring us your people. We want to pay for them to get the training. That's the catch. So our CEO, Vontan Quinlivan, she actually wrote this book called Workforce RX, which is based on many years of her private and public leadership in workforce. And she and our staff last year listened to employers say, help, people, public, all over the ecosystem. We're having trouble with retaining people and costs are high. We're having trouble reskilling and technology is being deployed. We need to add diversity into our new hires. And so the right side of the screen is really talking about how we are approaching these challenges. We're rethinking workforce as a supply chain effort. We're looking at solutions that have been used before by many of us on the team, including Vaughn. And we're also trying to align to employers' existing resources and efforts with the goal of putting the right people with the right skills at the right time to what's needed. Next slide, please, Lindy. And so Vaughn likes to talk about this, that there's a talent puddle. We post a job and we pray, please, someone show up. And then what we really try to do is how do we build that pool and make it so more people are in a talent pool. Next slide, please. For us, this really is 3 groups of people working at the same time, us working with 3 groups of people. So we connect with employers, we work with community-based groups and government organizations, and then our education piece. And I'll walk through a little bit of how that fits together, and then I'm going to walk you through a few of our pipelines. So you see back to remember who we are, right? We're filling the funnel, new people into how do we get them launched into and stay in healthcare roles, because they not only do they like it, but they're good at it. Next slide, please. One thing I will say that so far, we've been really proud about our talent pool. So the average age of a Futuro Health student is 30. These are working adults. 73% of our participants are women. We are 80% ethnically diverse, and 51% of our population speaks another language other than English. Why this is important is if we're talking about healthcare equity or access, this helps us bridge that gap for communities perhaps that don't have comfort or see themselves getting care from people that they feel comfortable with. So it's really important to us. I like to make sure we tell, and that's just with 2 years worth of work. Next slide, please. So investing in workforce opportunities for us, talking to employers, what are the needs? How can we help? And then our next slide is also the second challenge that we deal with, is partnering with community-based organizations to solve problems. Many of, especially the people on this call, are already doing certain things. You're already targeting either certain groups or certain occupations. How can we work with you to build on that? How can we connect some of the dots, perhaps? So, Nick, you mentioned, working with students, adults, either through adult ed or through career technical programs. How can we bridge the gap? I will say, as a longtime educator in our country, compared to, say, the Netherlands or several European countries, like, you go through the K-12 system, you pick a college, then you pick a major, then you maybe get a job after. There's like a question mark where if we were to do more around the junior high school age, even, there's a lot of data around how this might be useful. Do career exploration, help people understand what their strengths are, what they could be interested in. Imagine if that was what drove how you chose your career path and what education you either chose to pay for or get paid to do, so that you could actually be in a work role that you could be not only good at, but that's a viable work role. Imagine if we did that. So I know this is one of the ways we're trying to do a better job of again, connecting the dots. On the next slide, we're going to talk a little bit about education. So I don't know if you saw this recently, just last month in the state of Maryland. I'm just going to post it in the chat. They actually found hundreds of jobs where they removed the bachelor's degree as a requirement, because they looked at the jobs and they saw the competencies required, and they saw, are there ways that we can test for the competencies or look at what prior experience could be? And it was the first state to do that. It was really interesting. We're trying to do that as well, not to remove credentials, so to speak, but really help people understand what the paths might be that seem impossible right now. So I'll walk you through some examples, but we have both public and private educational institutions that we work with, and then we have our own proprietary preparation work that we do to help make sure people, even if they don't continue on to training for a healthcare role, the training we have, which is called Human Touch Healthcare, really teaches people some essential leadership skills that help them, especially new people to the healthcare sector, that are useful for everyone. Next slide, please. So I'll walk you through that here in a little bit. So let me finish this idea. Chapter 6 of the book that I mentioned, it's called Workforce RX, and that is, again, written by our CEO. All proceeds, by the way, fund Futuro Health's nonprofit mission. So every penny goes to a good cause, but it is actually a very good book. But the idea of, are there competencies? Are there modules and courses? Can we give badges and certificates? And then can those stack to lead to a degree? This is not rocket science, but how can we apply it in healthcare workforce training? Next slide, please. So one thing I want to mention about Futuro Health, the thing that's it's special because right now we have funding to be able to give away scholarships. As I mentioned, over 5,000 people have already been trained. They paid a small registration fee. We paid the rest. But why did we aim for 70% or more completion and 70% or more rate of employment. We're hitting higher than that in several occupations, including medical assisting, which is over 90%. And here's how it works, though. It's that middle piece. Not only are people applying and then they get a full scholarship, we give adult-friendly instruction. It isn't just a bunch of boring lectures or slides after slides. These are created for real learning. And then there's one-on-one support. And this is the thing I think that really, we have data that show, in fact, we can track the interactions we have with students. Every student is assigned a coach from the minute they apply. So we know that in a lot of populations, if application gets too unwieldy, I came from the community college system. You need a PhD to apply to their CCC Apply portal. It's very, very complicated, but we don't let them go. So we essentially stay with them from application all the way through their entire training, and then we make sure that they have completed. And last year we saw things like the kinds of interactions we were getting, students calling in for assistance with, they were going through grief. We had a lot of community members lost family members and friends last year, right? They were able to talk to somebody. So this is separate from the teaching support they're getting from their instructors. It's 400 interventions alone for emotional support, from everything from homelessness, food insecurity, car breaking down. Just having that support has allowed the students to persevere. We think this is really important, and we're doing some other research around what we can do to keep people going even once they finished. Do they still need that? And if so, how can we give it to them so they'll succeed in their career role? It's really interesting to us because we want to know how to scale this. We want to know how to include as many people as possible. And we want to, we want to make sure that we're nimble enough to respond to their needs. In answer to Alyssa's question, yes. Scholarships are open to all job seekers currently interested in any of our allied healthcare careers. So anyone who goes to futurohealth.org can apply for any of the open physician categories we have. So I know some people said, it was only open to members of SEIU, UHW. At the beginning, it was never just open to them, but it was always, they had first priority, but that's not, after the first year, it's open to the public. And also there's no requirement. You don't have to join the union to partake in the training. I just want to clarify that. Okay, see you later, Dr. Baker. See you later, Lisa. We'll keep going. So let me talk about the pathways a little bit, and actually human touch healthcare, which is the, so if we can switch to the next slide, please, Lindy. So we help the student get through the whole process, and then every training we have starts with an 8-week essential skills training, and that is Futuro Health content. And it's everything from cultural competence, empathy and compassion, ethics, how to communicate in a healthcare setting, teamwork, but also this emotional intelligence piece. That has a lot to do with self-awareness, self-care, self-management, and then being able to read signs. This is actually really important just as a human, first of all, but then that you're not just, especially caregiving. I came from hospitality, but still, my mom trained to be a nurse. The thing is, caregivers give more without realizing that they may be depleting their own batteries. And so we felt like that was actually a very, really important skill set to teach. Each of these this is taught in Canvas. So again, for adults who maybe not have been in training for a while, it's an introduction into Canvas with a facilitator. Each one is a different badge. So the students get through each of these and kind of build and get confidence. We're finding that everyone who completes this has actually increased our completion in the technical training when they've completed this 8-week. And as I said, even those that don't continue on, have given us feedback that the training was really useful to them. Next slide, please. So let me give you an example of how we can help build. If you think about Lego, so a sterile processing tech program, we have that available right now. Actually, everybody who wants to can apply. So if that middle logo there, Lego, I should say, first we have them go through human touch healthcare, and then this gets built on top. Underneath it, we have these coaches, we have career counseling. We actually have data science that we can use. So when we see that a student isn't interacting, we check in with them. And then obviously we do this tuition scholarship. Lindy, can I go to the next slide, please? So after that, a sterile processing tech can move on to become a surgical tech. And so how do we do that? Well, they get the sterile processing tech program, they go to work, they get some experience, and they can come back. We are offering a surgical tech program this year for the first time. And so they again have all of the other pieces of Futuro Health, but they're able to move up into another role, which is it's a very expensive program normally, and we're trying to innovate on how to fund it. So we just have a handful of spots. I think we have maybe 30 spots this year for that, but we're trying to figure out how we can help people move up once they're into that funnel that we talked about. Next slide, please. Health IT specialist is another one that we helped be agile about. There is a Google IT certification. We worked to curate some Johns Hopkins Health IT information, combine them, and then our Health IT specialist, which also is available. And that one is on Coursera, and it is asynchronous. So we've had people take up to 6 months. Some people have done it in 2 weeks. But at the end of it, we pay for the CompTIA A+ certification. So someone can take this, we pay for everything, and then they have the coaching throughout. And then they actually, we've had students go on to actually work on getting a bachelor's degree because they realized, oh, I really like this. This was easy. It was a great way for me to check it out. I can work while I get my bachelor's. Next slide, please. Some more traditional, health IT to data science role. So the idea again is you get the training, you go to work, you continue with your bachelor's, you go to work, you can continue on with your degree pathway if you wish. Next slide, please. Another pathway that we're building out is the medical assistant. How can it lead to other things? And we're looking at some of these roles that we're seeing are becoming more important. We've heard about RNs a lot. Yes, we know that's an issue, but there are also other things on the way to get there. And how can we help? How can we perhaps facilitate a pathway? This is just one example for the MA pathway. Another example, next slide, please. In behavioral and mental health, so we have a community health worker with behavioral emphasis class. We also have a 10-week behavioral health, which I should send you all. I can send that to you. We have a 10-week behavioral health micro-credential, which we offer to nonprofits and anyone who wants to have their staff go through it. Because sometimes you may need, we're seeing a lot of educational staff, county workers. We've been told, people come in, they have a bachelor's degree, but they really don't know how to, they need some behavioral health training quickly. So we are offering scholarships for that as well. I can send that to you if you're interested. But the idea is that there are other things they can go for, either an associate's degree, bachelor's, all the way up to master's, but we can get people started. We also were just approved by the state to be one of the state training providers for peer support specialist, and it was based on our portfolio in community health and behavioral health. Okay, so next slide, please. I know Alyssa's not here, but we're talking about CNA. So the CNA to nursing pathway, certainly CNA to the VN or LVN as we call it here sometimes, the RN, and then looking at how do we help the RN get to the bachelor's. So all of these opportunities for nursing, it isn't necessarily, oh, Lindy had asked a question about demand. So yes, there's a need. Is there actual demand for these roles? In other words, do people want to go into these roles? I need to do some more data hunting for you, some more research, but I can tell you that we are looking to expand by adding a VN training pathway to our portfolio this year. Interesting, the issue isn't that we don't have enough, we have people who want to take these courses. Capacity is the issue. So we have this many community colleges we're talking to right now. All of them say, I only have 25 spots and there's a wait list. So we ask, can we add another section? It would take me too long to answer the question here, but my point is there is demand for on the student side. So and we're trying to figure out how to unlock that. Just know I wanted to mention that to you, Lindy, but I thought I'd save it for the bigger presentation. Okay, next slide, please. We're trying to figure that out. So how do we get that win-win-win? And I think the main thing I wanted to chat about with you all is we're trying to figure out how to work with people to solve the problem innovatively. And so we do a lot of pilots. We'll say, okay, maybe we'll do a pilot for how to get this group of people into this role. And we love partnering with folks like you to try. I mean, there's no time for this. We've got to just get folks into these roles. And we know what training works. And we also know that once we get people feeling like they really have that support to do well, the workforce is really engaged. I think, I'm not sure if I have any more. I think that might be the end of the slide, so I can go back to no slides. And you have my email in the chat. But I think what I wanted to just open up to was answer questions, but also let me give you a couple of thoughts of how just examples. One area is apprenticeships, right? We've heard about how apprenticeships are important, but how do we actually operationalize that, especially for things like CNA to LVN? There are existing apprenticeships in California for that, but where are they? How come we don't know about them? How can we, though that's the other thing, there's a group in LA that I worked with that is actually doing this it's a grow your own strategy. Essentially, they are recruiting, it's a clinics, recruiting people to become MAs. They're supporting the MAs by providing a stipend. They've committed the clinical externship, and then we're doing the training for them. So if we can do that with you all, we would love to do that. Let's figure out how to do that. So that's one example, but and we're working with folks like veterans in transition, opportunity youth, immigrant worker. Like there's all kinds of ways we can bring a more diverse group that maybe people haven't really thought about. And then also these transition folks. So, okay, I will stop and answer questions. I know a lot of people have to go. Lindy, how can I just open it to questions, I guess.
Yeah, absolutely. Thank you, Joy. I do have Joy's slides, so if anyone wants them, Joy, is it okay for me to share those?
Sure.
Okay, great. But yeah, does anyone have a question? Feel free to just unmute. We're a nice small group, so that should be easy.
What's the easiest way to refer someone?
Oh, well, it depends. Because here's the thing, we didn't used to have a registration fee the first year. And then everyone thought this was BS. Like, they're like, this cannot be real. You're telling me there's no cost. I'm going to get a full scholarship. So actually, if you Google, is Futuro Health, you'd get real is the first question. Literally like, this isn't real. So we added a $150 registration fee. So the easiest way to refer, if you think the students have the $150, is to send them futurohealth.org. If, however, you want to work with me to figure out a way to either reduce those fees for them on your side or with a community group that you think would a tiny fund, we can make a special code just for you, send you a special portal, and then we'll track that. Totally happy to either way. But the easiest way is Futuro Health, just put it out there. It's out there. But if there is a way, because like in San Diego, they have funding for things like wraparound. They can get a laptop for the people, or they can pay for bus passes when it comes to clinical externship. Like if you have other things like that, let's talk, because then we can do a joint flyer that kind of explains the whole thing, and then we're off and running. So yeah. Yes. Thank you so much, Betty. I hope to hear from Bob. Yeah.
So that's really impressive. And I like Futura. I've worked with Vaughn for some years, and it's really a phenomenal program. Thank you to Kaiser and others who support that so heavily. We have probably 25 workforce groups in Contra Costa, maybe 12 or 15 that are health related. And the two major problems that we have are recruitment, which we've tried to really work through our community-based organizations to really increase equity and diversity. And the second thing that we found is in order to be successful, we need to find a way to pay people while they go through training. And right. You talked a lot about tuition coverage, and you talked a lot about wraparound services and those kinds of things, but you didn't talk about stipends while people are going training. Yeah. So one question would be, do you have that program? And then two is, how do we connect the dots, right? As Jeff Oxendine, it's his copyright, connect the dots. How do we get all these groups together into one? For example, SEIU, UHW Ed Fund, is involved in a sterile processing apprenticeship program.
Yep.
Right? maybe with you as well, right?
No, let me stop right there. Ed Fund
Well-
only applies to people who are already members. So
Right,
we're doing new, right?
right,
So they can do that later if they already are a member. So we're right next to them. They're right here,
right,
our partner, but for the new, that's
right.
us. Yeah.
So we're doing a program with them for paramedic, and we're trying to
Yeah.
make EMT paramedic apprenticeship program for new people with the Ed Fund. And we'd like to have your involvement in that as
That'd be
well.
great.
So maybe we all set up these boundaries and we all have our fiefdoms in these workforce planning, but somehow we've got to connect those
Yeah.
dots to all come together. And we got to solve that problem about financing for people who are taking the class. So the real question, other than the comment, was, do you have a program that you pay for folks while they're training? Because that's really, really important.
Yeah, for sure. Now, and Rebecca Hans and I meet all the time. So yes, we would love to work with you on that EMT paramedic. And we have apprenticeship on our radar for sure on multiple fronts. Our scholarship dollars can only pay for tuition and books. However, as I mentioned, like in the LA area, we welcome when community groups are able to pay that little stipend, because that externship, as you know, expects, like medical assistant, for example, it's 180 or 190 hours. It's unpaid. You know what people do, right? They don't do it. They get the doctor to sign off and then they start working and they're paid. Now that doesn't help anybody. They don't really get the certification. The school that teaches them doesn't get the completer because they didn't finish their externship hours, so to speak, right? So it's really not good. But I agree with you. That's the question. And maybe that's another work group question is, our funding cannot pay that, but we are looking for ways to try to figure out how to do that. I'm a big one about, well, yeah, these are all online. What if you don't have a laptop? What if you don't have broadband? Like someone has that funding though to support that. We don't have that, but who can? So how can we give the student a whole package? I think the other piece is that you bring up a really good point. Like some of these things they're not allowed to be paid, or even in the RN, LVN pathway, the work that you did as a VN doesn't count when you're an RN. What? So there's like policy work that needs to be changed to also remove some of the barriers. Back to your connected dots comment. I mean, I agree 100%. It's people like you all hopefully guiding what we're doing that can maybe make a change, because we just don't have time. Like we could talk about it for another 20 years. It doesn't matter, right? We've got to make some changes. So yeah, no, I would love to figure out. Oh, look, my sleeves are already rolled up. So
Great.
Did you have a comment, DC? I'm sorry, I thought I saw. Oh no.
Yeah, sure. I mean, it's really related to what Bob is lifting up in terms of making these opportunities affordable. What was striking me was the median income or the median salary in these different pathways. And to be honest, in this area, $38,000 is not a quality wage, right?
Right.
In terms of sustaining a family. So just kind of to the point of recruitment and selling this long pathway. Like we know it's a huge celebration when we have folks in our programs who complete the CNA or the MA or the DA, but that still doesn't get them to a living wage.
Right.
In this
and this is back to my comment about why do I work in a hospitality? It'll never pay out. It's like, well, we all talk about career ladders. You're exactly right. Career ladders. But we need like a rope ladder to get to the step ladder, and so like how, and then once you are there, you can actually get there because employers are happy to show you the way to get more training or get the Ed Fund or whatever. They're actually, you don't even know what's there. And so you're right. The whole picture is what we need to talk about.
And critical to that is what Bob mentioned, which is the stipends, right? And we have a couple of programs that we piloted around the stipends just to make it affordable.
Yeah.
To take that first leap. And I think that we'll need to look at longer term investment so people can sustain that trajectory.
It's tough though, because like I said, even that group I was mentioning, and you're right, trust me, everything you're preaching to the choir. This is great to hear. And I want to do more with you all in East Bay. This LA group committed 20 stipends, clinical externship, as well as they would pay the reg fee. So there's zero tuition burden. We only have 8 who've taken. They have been recruiting for 2 months. So this is the thing, right? It's like, you're killing me here. Like what else could we do? And so I think it's hard because we're still trying to figure it out, but with
Yeah.
that, then how can we even make it more?
That's a good clarifier, Joy. So your current programs are in SoCal, so you don't have a
No,
community
they're
college
throughout.
partner?
I'll partner with whoever. That was just the group that was willing. That was my first group that was willing to pay stipends
Got
to
you.
medical assistant. Yeah.
So who are your community college partners here in this area in NorCal?
Well, I'm a long time, you have to remember. So I know all of the community colleges. And so the training that we're talking about is actually a community college that's in a different school district, Kern, because they're one of the only ones that offer it approved online and have for many, many, many years.
Okay.
And so, yeah, I will gladly work at the community college, but you guys know, if you don't apply in August and you don't apply in January, and then the other thing, we got our community college innovative partner, who was, it's Saracoso is the college. It's 8-week modules. And guess what? The students only register once. Not like, oh, well, you missed the cutoff. There was a wait list. Sorry. That's a problem for our adults, right? They don't need that. They want to apply once, they want to get through the training, and then they want to get work in. And so we need those community college partners to say, yep, we can take care of that. We want your students. We want your money. And so we can only work with people who really show up for the students. Do you know what I mean? And this is no disrespect to anyone in this landscape of education. It's just that those things are what are keeping people from completing and then being able to work. And so we really are trying to solve it. Yeah.
Joy, do you find that there's a lot more interest in one program over another?
It depends. There's a group that actually in Indiana I was working with. They work with K-12s and they're actually innovatively providing career training to the parents of the students. So really interesting model. And they say that 75% of their interest, this is just, I thought you might find this interesting. I just had this conversation last week, is either in healthcare and they named a couple of occupations, but it's either healthcare or IT. Really interesting to me because I'm trying to dig down more like, well, why and what roles? The thing about healthcare IT as a specialty as well, or data analytics for healthcare, it's not patient facing and can be done remotely. So people are somewhat interested in that because I'm helping in the healthcare system, but I don't have to, bodily fluids or show up to a clinic, right? But really important work, especially in the remote world where people need help getting connected to their healthcare providers or getting an appointment or whatever. So that's one thing where we're seeing that intersection kind of healthcare and IT, the interest areas. But that seems like an area, Linda, you mentioned is what are people interested in? Good topic. What will they actually show up for though? That's the other thing.
Right. Yeah. Certainly enrollment versus completion, right, is always an important
That's why we
thing.
don't count enrollment as a number. Like we're trying to complete how many people get complete and how many people actually get a job. That is our marker. So, yeah.
Well, Joy, I certainly look forward to talking more about that. I know you and I talked about kind of continuing that conversation, and I'm happy to share with this group, a little bit of a report out about that further conversation that Joy and I have. But that's the end of my questions. Did anyone else have a question? I see Sarah joined us. Hi, Sarah. Do you want to introduce yourself quickly?
Hey, you guys, I'm so sorry I was running late. My name is Sarah Chadakwitz. I do government affairs with John Muir Health. So I'm one of the healthcare delivery systems in the region.
And she helps to plan these meetings. So thank you, Sarah, for being here.
Oh, thank you. I wanted to put really quickly before I let you go, there's a fact sheet on Futuro Health. I'll put it in the chat. But really, if you I would love to follow up with you if you think there's a way that we can help either share what we're doing to other people, as Betty was so kind to ask, how do I refer people? Our programs are open to the public to apply. We provide, currently our funding allows us to provide for full scholarship. There's a tiny registration fee at the beginning, essentially to secure that people are committed, but we don't want to stop people who are really interested and maybe just need a little extra support. So please reach out. We are looking for clinical externship partners. As you know, that's the first chance to look at the good people, right? It's like you get them, they're right there. So I actually have one of our staff members is in charge of that. And then we're looking at piloting any way to help. So just reach out to me. I'll put my contact information here again, but I'm happy to chat with you more, or if there is, as you mentioned, Bob, if there are larger initiatives that we can help with. Essentially, we would ask to be intermediaries in some ways for some of the apprenticeship programs. I've built them in other sectors, and or sometimes also just how can we support whatever you're doing. We're here in the ecosystem, we're trying to solve the problem, and we're all in this together. So
yeah, I mean, I think it's really good to partner. Like we have 80 students in our medical assistant program at the Kaiser School of Allied Health.
Yeah.
You know, we had 60 and we've increased it this year to 80.
Nice.
You know, obviously we have clinical sites because of Kaiser and a couple of others, right? And so we just have to find ways till we work together. We've applied for ETP funds and HRTP funds and WIOA funds, et cetera, to try to build a way to, you know, get those stipends out there and get that support services. So I think, you know, your organization, along with all those other organizations, if we all work together, I think, you know, we can have a hell of a program here. And that's really the key, I think. So it's really good to hear where you're going with Futuro. That's really helpful.
Absolutely. Thanks for the opportunity.
And that it's so open. I think that's exciting too, you know, that this is something we can share far and wide, and give folks the opportunity to kind of learn about a program, or perhaps hopefully even continue through it and complete it. So
right, let me just tell you really quickly, the 3 minimal quals: you have to live in California. That's kind of easy for your region. You have to be over 18. So even Nick, those students who are going to be 18 can apply as soon as they are. And then you cannot have a felony, because you're not allowed to work in the healthcare settings where right now. Now, that was another talk we were talking about. Sort of, is there a way? I know there's talk, BRN, supposedly there's some things we're looking at, folks who have a record, how that can be expunged with service. You probably know more about that than I do, but fascinating stuff happening policy wise, right? So when we're partnering together, we're not just trying to solve this, we're trying to solve like what is actually in the way.
Other barriers.
Yeah. So I just wanted to note that, but it is absolutely open, and you have my contact. Please let me know how I can help any of your partners or students or community members. And then, yeah, absolutely. We need to just, my colleague, John Cordova, he's a public health nurse, and we're really interested in, apparently CDCR has a pilot they're looking at where students can train to serve the population behind the wall, so to speak. So if they're, I'm doing it a very bad job of explaining it, but it's very interesting because otherwise folks who have a record would not be able to get that training. But if they're serving the people who need it in the prison system, they can actually be employed in that role. So yeah, they're looking at ways to remove barriers, actually. So I have to show you one thing before I go, which is this. So my lead grant writer is a woman named Deborah Jones. She used to run adult education in the state of California, and she gave this to me. It's a 3-dimensional heart. So as I started the call, I want to end with gratitude for the work that you do to help make the world better. Thank you so much for the time.
Thank you, Joy. It's been a joy to have you. I'm sure you get to hear that a lot. But thank you. And we'll certainly help to spread this information far and wide. And as I said, we'll be in contact because I know I have some follow-up questions. And really, it's been great to hear from you. And thank you all for joining us.
Yes, thank you.
I appreciated you being here. I will also say, just for those of you who continually engage in the Opportunity Task Force, it is possible that we're going to be looking at a new time. So if you happen to see an email come out that has a survey or some information we're trying to gather about that in the near future, sometime in the next month, if you could just let us know timings that tend to work best for you. For the last year, we've been hosting this meeting from 1:30 to 2:30. And we've seen that for some folks that works really well because they can kind of just plan it right after lunch. But for some, they really miss that morning meeting. And we used to host most of these in the morning. It was kind of easier for some to fit into their schedule. So we might be looking for some feedback on that. So if you see something coming forward, please just fill that out so that it's easier for us to make sure that these are easier for you to attend. Thank you so much for being here. We'll see you hopefully in May.
Thank you, everyone. Take care.